A lot of the videos that you've posted when you've discussed insurance, and you discussed many things, but when you've discussed insurance companies and your interactions with them, have been about the frustrating ways in which the company comes between you and the care that you want to and need to give your patients. So perhaps you could elaborate on the ways in which that interference occurs in your day-to-day practice.
Right. So, I mean, I think it boils down to the fact that you've got these two forces at play. You have doctors who want to do the best thing for their patients, like health wise, and you have companies who have a fiduciary responsibility to their shareholders to maximize profits. And we're meeting in healthcare, and patients are feeling the force of that impact. Um, it's things like getting a pre-authorization for a surgery. I employ two people full time just to get authorizations for me to do necessary medical procedures for women affected by breast cancer. So, and I'm in network. I'm not trying to do anything like out of network cash pay. It takes two people all day long, full time, just to navigate that process. Um, and then, insurance companies tell you which drugs you can prescribe. They tell me what type of implants I can place. And it varies from insurance to insurance. So, Blue Cross might be okay with me using, for instance, one product, and then another company says, no, 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 you can't use that. You have to use a different product. So it requires me to make decisions based on the policy the patient has and not on my medical experience and recommendation.
The first video that I saw of yours personally was the one, like you mentioned, where you were actually having to scrub out of a procedure where you said the patient was literally asleep and unconscious, about to operate on them in order to speak to this insurance company.
I just did 2 bilateral deeps and 2 bilateral tissue expanders for patients. And I've never had this happen before, but during the second deep, I got a phone call into the operating room saying that United Healthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. And, said I had to call right now. So I scrubbed out of my case and I called United Healthcare, and the gentleman said he needed some information about her, wanted to know her diagnosis and whether her inpatient stay should be justified. And I was like, do you understand that she's asleep right now and she has breast cancer? And the gentleman said, actually, I don't. That's a different department that would know that information. And I was like, well, she does need to stay overnight tonight. And you have all the information with you because I got approval for this surgery, and I need to go back and be with my patient now. But yeah, it's out of control.
And that really struck me. And I don't know if I was ignorant in this, that I didn't realize that this was something that doctors were literally having to do and take time out of their day away from patients to personally speak with these companies. Is this common across the medical field that doctors have to do this?
Yeah, I think I was shocked that I was reached in the operating room, but it is absolutely the case that doctors are interrupted in the middle of patient care every day to deal with insurance issues. And I'll give you a specific example. So when I, for instance, want to do a breast reconstruction, I might call United Healthcare and say, I want to do this surgery. And they say no. And I say, well, what's my recourse? And they say, you could have a peer-to-peer conversation about this. And I say, okay, I'd like to do that. Let's schedule it. And then they tell me our only time slot available is at 3 p.m. today when I'm in the operating room or in clinic. And then they say, if you don't do the call by 4 p.m., we're going to deny it. So it's like, drop everything, show up, jump when we say jump, and go as high as we ask you to go. And then usually, I get on and they say, well, we're going to deny it. And then I have to appeal. So I think the principle that doctors are interrupted constantly to deal with insurance issues is a really important one. And being called out of the operating room was crazy, but it was also, it was just taking it one step further. And doctors from around the country reached out to me and said, I can't believe that, in the letter that United sent to me, they said, oh, we would never do that. And doctors around the country called BS on that. They were like, no way. No way. They do it all the time. They do it all the time.
Another thing you mentioned in one of your videos is not only do they say you have to have a call at this time and we'll call you, but sometimes they don't even call you at that time. And then you have to waste your time waiting to speak to them.
I mean, and this is why I started to share these absurd moments, because they're living in my head rent free, right? So I have this impression of insurance companies that's been developed over time, but the public isn't privy to that. And they don't know that all of us doctors have all of these experiences, and we're used to, as physicians, putting our needs to the side and just dealing with the patient issue in front of us. But it felt like it was time to start talking about the background noise and letting you guys in to hear what's really going on. So, when I have a phone call with a peer-to-peer call that's scheduled, and then they're an hour and a half late, and then I get on the call and I can tell that the person is distracted. Like, it sounds like they're at a grocery store, like getting their groceries. And then I say, well, I'd like to talk to you about deep flap surgery. And I hear like a pause. And then I say, do you know what a deep flap is? And they say, no. And I'm like, why am I even on this call? I feel bad for all of us here. This shouldn't be this way.
Yeah, I mean, that was what really stood out to me from one of the more recent videos that you posted, where I think it was a deep flap surgery. Sorry, I'm saying that wrong. That you were trying to get coverage for from one of your patients. And number one, the doctor that was on the other end of the line wouldn't identify themselves. And even when you pushed for it, it sounded like they were an ophthalmologist, which is an eye doctor. So obviously a completely other field, wouldn't even necessarily know what you're referencing.
Are you a plastic surgeon? What do you mean subspecialty plastics? I'm a plastic surgeon. I wouldn't say subspecialty. So you're an oculoplastic surgeon. What was your initial training in? So we're speaking about lymphedema of the arm. So this is not an area that you're familiar with, correct?
Yeah, so that case was that was a microsurgery case, but it was for something called a lymphovenous bypass, and it treats lymphedema, which is debilitating for many women who are affected by breast cancer. And we, for many years, have not had a treatment for that, but we do now. We have something we can offer. So in that case, I called to have this peer-to-peer. They called me. And that's a funny call, because what I felt was they showed up with two doctors on the call, and I was like, they know it's me, they know it's Dr. Potter. So, because that's not normal. You don't usually get two doctors on the call. And then they were trying to meet like the letter of the law. So they had a doctor in Texas. I think what you're supposed to have is like, a doctor in the state who's in the same specialty. Well, so they were kind of patching it together. They had a doctor in Texas who's an ophthalmologist who said that they had a plastic subspecialty. And as soon as they said that, I had their number, because no plastic surgeon would say, I'm plastic subspecialty. That's just not something we say. So it's funny how like someone's vocabulary reveals their expertise. And then the other surgeon was just a cosmetic surgeon. And, I think in that phone call, I tried to keep my cool, and I usually do try, but I was trying to find out what level of expertise they had without them providing their license number or credentials. And so I had to dig deeper, and I had to ask questions like, do you know the percentage of patients who develop lymphedema in this circumstance? Because they wouldn't give me their credentials. I had no other thing to go on, right? I needed to verify in a very specific way. I wasn't trying to embarrass anybody. I was just trying to get to the heart of the matter.
What is a peer-to-peer call? If you could sort of summarize that just a little bit. Are these doctors that are paid as consultants specifically by the insurance company in order to, I assume, cover less procedures?
I have never worked for an insurance company in that capacity or seen a contract for that. So I can't tell you exactly how it's structured, but in theory, these are my peers. So this should be a call between peers to discuss a medical matter, and to come to a medical decision, right? It's an opportunity for me to be heard on behalf of my patient. But in practical language, what happens is it's just a box they're checking. In fact, in the call that you referenced, at the end of the call, the doctor said to me, I don't have the power to make this decision anyway. United has already decided. And I was like, there we have it. What a waste of our time. And it's like, it's for show, right? So yeah, a peer-to-peer call is supposed to be a chance for me to advocate for patients. And I will tell you that it with some insurance companies, it is a bit more like that. So sometimes they get on a phone call and it feels like, okay, we have something in common, me and the peer. and that is the patient. And we're going to try to come to, a decision about something for a patient that helps that patient. And the ones that I've posted, obviously it's not that.
Just to sort of help us better understand how this system all works. I mean, the very fact that you're advocating for patients. I mean, you're a doctor. Your job should be to treat patients and then tell the insurance company what the patient needed, and then the insurance company has to pay if the thing is covered by the policy. But instead, you're having to sort of be a lawyer as well as a doctor, in which you're sort of having to convince this company, and then the company, as far as I can understand, is like the ultimate decider of what treatment is medically necessary, even though they've never met the patient, they've never examined the patient, they're maybe in another state.
Yeah, it sounds like you're describing a company making medical decisions. Which,
Yeah.
yeah, that's what it sounds like. And I mean, it shouldn't be that way. But I think even just breaking it down that simply for the public, because as a doctor, I mean, I think it's reasonable for a patient to think that they come to see you, they'll get an exam, they'll get a diagnosis and a recommendation for treatment, and hopefully your help in obtaining that treatment. And, what actually happens is, I can do an exam and I can come to a diagnosis and I can even recommend treatment. And then the work starts. Then it's like, how do I get this for you? And I spend a lot of my time just trying to get the ball across the goal line. So it's not what I signed up for when I wanted to be a doctor. And I think it's what's burning out a lot of physicians. And I think most of the frustrations that I see patients experiencing as well, whether it's with a prescription or a surgery getting scheduled or canceled, the frustrations aren't usually, the majority of them aren't in those initial interactions, right? They're not in the exam and the diagnosis and the discussion. They're in just executing it. And isn't that what insurance is there for? Isn't that really the only piece they're there for? Why aren't they doing that well? Because I'm showing up and doing a great job at all the other parts.
What a cruel human tragedy to know that things can be done, to have the skill, to have the equipment, to have the time, but be unable to do them because of this, corporate entity that controls the money. And as you said, you're dealing with women with breast cancer. You're dealing with women who are going through the worst thing that has ever happened to them, who are facing, the possibility of death. I mean, and then having to spend all this time just fighting to get the thing that could be. I mean, it's bad. Isn't it bad enough having breast cancer in the first place?
I'll tell you two things that come to mind. One is, so I had a patient recently who told me, and you may have seen this, that she was more scared of the insurance company than she was of her cancer diagnosis. And that was after months of battling with an insurance company to get a mammogram, a biopsy, and a surgery, and then finding out she had metastatic cancer. And she said that, from a cancer treatment standpoint, she believed her doctors knew what was best and she could understand the rationale of treatment, but that insurance was just so cruel and unpredictable that was frightening to her. The other thing I would say is that, in the US, I would assume that, sure, I encounter problems all the time in the healthcare system, but I'm a problem solver and I can come up with ways to navigate that. And I spend a lot of time doing that. And I think that's what some of my videos are about. But what I'm seeing increasingly is that insurance companies are seeing doctors try to navigate and they're throwing up more obstacles. Like, no, you can't do that. We're gonna keep you out of network. No, you can't start a surgery center. No, we're in charge of everything. It's almost like the mob. And it's like, I want to put up a shop on a street and I'm a surgeon, that's my skill, right? Or I'm a baker, that's my skill. But in order to have a shop on this street, you have to pay a tax to the Godfather. That's what it feels like to practice medicine in 2025. I have to pay a tax to the Godfather, and that's insurance.
After you posted your video about how UnitedHealth called you when you were in surgery, the company apologized profusely to you and rolled out a new set of practices showing that it would never happen. Oh, I'm sorry. They said you had defamed them and they threatened legal consequences. And you're recently featured in the New York Times in an article about how they do this to all of their critics. Could you please elaborate?
I love this. This is so great. It's funny how like time and space gives me the ability to laugh at this, because the day that I received that call, I sat in my car at like 5 a.m. going in to perform breast reconstruction. I was terrified. I was terrified because I knew that a company as big as United could take me down. And I also knew that like I have to decide. Do I speak up? What do I do? Am I just going to try to make this go away or apologize like they wanted me to? But my gut, I mean, it's just not who I am. I've never been somebody who, backed down when someone else was getting bullied. And I know what's right. And I've got to be able to sleep at night. I'm 49 years old. Like, I know what it's like to do something and regret that you did it. I'm not doing that here. I'm going to take the beating and I'm going to stand up and I'm just going to trust the universe that something good will happen. And it's been painful, but it's been the right thing. It's the fact that we're having this conversation means that was a good decision.
Yeah. And I feel like you've been able to stir up a lot of conversation from people that I think there's a lot of people that have had personal horrific experiences with their insurance companies, but may not know that this is kind of built into our standard of care for what people have to deal with. When it comes to United, you even mentioned that someone showed up at your house to try and talk to you.
Okay, so that was actually not United that showed up. That was the president of a society. So that's a different thing. So it wasn't United that showed up at my house. Now I've not said this out loud before, but I had, right after I received that letter, for about 2 days, I walked out of my house and there was a car parked there. Like very early in the morning, a dark car. And I had a feeling that somebody was there just like observing me, and that I'm not like paranoid, but I did have that feeling. I also went to the hospital shortly thereafter, and they had installed cameras in my operating room. Only in mine. Only in the hospital. The hospital installed cameras in the operating room. And I was like, why did you guys do this? There you have 20 something ORs. Why in my ORs? They said it was something they were doing, but that was around the time when the hospital and, which is a big group, and United were talking about how this phone call had happened. But the person showing up at my house was from an academic society or a professional society, and they were telling me that I needed to be quiet about advocating for coding changes.
If people should read the New York Times article that just came out, which is about the extraordinary lengths that they have gone to. I mean, people who hear what you're saying there without context might go, "Well, that sounds crazy." But actually, when you read, I mean, you're not the only one who they've done this to, and also they talk about how you were hoping to get to be classified as an in-network provider with UnitedHealth, and after your video went viral, they stopped replying to your, because you exposed this heinous practice, and you're just telling the truth about how this system works. But they have all sorts of ways in which they, the letter they sent just threatening you, suggesting you defamed them, suggesting that you needed to apologize. I mean, you used the language of The Godfather earlier. I mean, really, short of outright violence, I mean, they are using every means of coercion that can possibly be used within the bounds of the law.
Yeah, and that's what it feels like. It feels like if I behave nicely, if I'm a nice girl, then they'll leave me alone. But if I have things to say and if I have opinions about the way that they're directing care, then I bear the brunt. And it's in subtle ways, but it's also obviously in more direct ways, like receiving that letter. So it's a dark time. It's a dark time, but it's also encouraging to see, like, I guess I see that both patients and providers are on the same side here. And I didn't feel that before. Before, I often felt like patients blame doctors and doctors blame patients. And that really did work well for insurance companies because we weren't noticing them, right? But now we're like, wait a minute, why are we fighting each other? There's somebody else pulling the strings here.
Hope you're enjoying this interview. If you want to listen to full-length current affairs interviews before they are made fully available to the public, please visit our Patreon page at patreon.com/currentaffairs and become a supporter today.